COVID-19 numbers are surging in Thunder Bay. We talk with Judith Monteith Farrell, the MPP for Thunder Bay-Atikokan. It's James with NetNewsLedger. Joining us is Judith Monteith Farrell, the Member of Parliament for Thunder Bay-Atikokan. Judith, welcome to NetNewsLedger again.
Thank you, James. Hope you're well, you and your family.
We're working our hardest, I think a vast majority of people, but we're watching these COVID numbers. I mean, the Thunder Bay District Health Unit just released that there's 350 active cases as of today, the 26th of February, 60 new cases today, another death, and a whole bunch of people in the hospital. We're running the risk after all this time for the past year of doing exactly what they warned us about a year ago.
You're right. The situation is extremely distressing to see those kinds of numbers and those people in hospital and intensive care. And we know that there's many people in isolation units and isolating at home. And that is a certain kind of stress as well, not knowing or waiting for test results, which is a longer wait than it is in Toronto, that's for sure. We also have the whole pressure of the people that are affected, and many of the people that are affected are in isolation units. I think the numbers right now are close to 130. I could be it's over 100 that are in isolation units that have been provided. But we also need the resources to assist those folks when they are in isolation units with their health, with their safety, and how do you manage that without the resources, especially human resources that we need to tackle that.
I think if Thunder Bay were Toronto with the numbers we've got, we're 150,000 in the district. They're 3 million. They've got 300 and something cases today. We've got 60. The ratios are just blowing the doors off. Speaking with Mayor Morrow yesterday, he said he's trying to get the province to provide more help and more support and bodies to come in and help. And he's not getting the action as fast as he'd like. Do you think the Ford government is working as best they can?
Well, that's hard to say because what they say is they have their eye on it, or they're consulting. And I know they are consulting with Ontario Health North. They're consulting, but like we said, this was known weeks, like 2 weeks ago. I had sent letters and concern throughout this time over a month ago, even when we just came out of lockdown, saying we need to ensure, because we knew that once it was in the jails and it went to the vulnerable sectors, that we didn't have the capacity to control that. We don't have the spaces to make people safe. And then we had the cold weather, which didn't help, because then people were confined and were put into place. So I was told yesterday, I asked another question, where is the help? Why are we dragging our feet? And the health minister was saying, yes, we have our eye on it. We're, going to be providing those resources. And, but like I said, I think those resources are late, and it's led to the numbers that we now have.
Well, early this week, I asked Premier Ford's office on the lockdown situation here, and I got back the boilerplate out of the press release saying that they were going to let 28 days or 2 COVID cycles of 14 days go by before they do any change to the status. And meanwhile, we were soaring out of control. So do you think that means, is that keeping the eye on the ball?
Well, it's like many things. There is this structure where they say, this is the plan. This is how we deal with this. And they've put this template in place. But I think it really did not meet the needs of a small community like Thunder Bay. When you have all the resources at your fingertips, maybe that template works, but it doesn't work. And it didn't work in all long-term care settings. It was too little, too late. And the lack of planning around that, we knew when we came out of the first wave that we were going to have a second wave. I don't understand why planning was not in place to say, if we have an outbreak in this jail, what does that look like? And when I read some of Dr. Williams' testimony, it was, well, we hope that the private sector, long-term care home would have that PPE in stock. We would assume that they did. Well, who was checking on that? And then who was checking on the Solicitor General and the plan for jails? We had the time to put the safety net in place, and we didn't.
I always think back to that old adage about assume, because when you assume, you make an ass of you and me. And, that seems to be, the best intentions are there, but we're watching results that prove that those intentions are being delivered.
What's really frustrating, James, is the people of Thunder Bay, the resource people, the frontline workers that are working on the ground, administratively, hands-on, they are doing everything they can. Like, they are working, tirelessly, like 7 days a week. They're putting everything they can. The citizens of Thunder Bay have been very cooperative, for the most part, very compliant with everything they've been asked to do. And that we're not seeing, and we're saying, at some point you're saying, I'm doing this all, and why are we looking at these numbers? And I think we need to see that was a failure. It was a failure, and just admit they made a mistake and get on it. I mean, I'm not in it to blame them. I'm in it to say, okay, what are you going to do about it? Like, it's too late. We have this explosion of cases. What are you going to do about it?
I think that's the question that all of us are asking, pointing fingers of blame. I mean, I've seen it on social media, it's all Premier Ford's fault, or it's all Mayor Morrow's fault, or it's all, Dr. DeMille's fault. And I'm thinking, really? It's something we all are in together. And if we're all going to come out of this together, we're all going to have to work together.
Exactly. And there's no point in that, pointing fingers. What we need to do is ensure that we get things done and get the resources we need in our community, and hopefully then move our case numbers in the right direction.
Judith, I want to thank you for taking the time today.
Thanks, James. And thanks for, highlighting this really important issue. The people of Thunder Bay really are lucky to have you. And so thanks a lot.
Thank you. To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.